Healthcare marketing, health communications, and health literacy could really stand to work more cohesively together. Unfortunately, those roles are often separated and siloed, and they're not operating as a unit in a way that would be most beneficial for the patient population that everyone is aiming to serve. One of the elements of healthcare marketing that would be beneficial for health communications and health literacy teams to absorb is an understanding of the patient journey and the patient experience. So we can even bring patient experience teams into this conversation because those are often separate individuals and departments as well. Understanding the experience that the patient is going through before diagnosis, through diagnosis, and after diagnosis is critical to understanding how to best support them with information and with other resources throughout that journey. However, if we don't understand or if we don't center our strategies around what that patient is experiencing at that particular moment in time, the educational initiatives we create and enact will be less effective than they should be. Now, before we get too deep into this conversation, if we haven't had the chance to meet yet, I'm Megan Freeland. I'm a public health pharmacist by training, but my work is a blend of health literacy, patient advocacy and engagement, and health communications. And you are listening to the Health Literacy in Real Life podcast, where we explore the role and the importance of organizational health literacy in improving patient outcomes. Allow me to paint a picture for you. In my family, Thanksgiving dinner is a big deal. So I want you to imagine that you are a patient. You have very little exposure to the medical field. You're not familiar with healthcare terminology, how the systems work. You are at the dinner table, and staff are bringing you dishes. They are placing them family style on the table in front of you. Some of them you've never seen before. Some of them you have no idea what they are. They look okay. You think that they might taste good, but you're unsure. The staff fills the table with these dishes. Some of them are labeled, but most of them aren't. And the ones that are, they are in different languages or they're written in a way that maybe the chef understands, but without Google or a translator, you aren't sure exactly what those labels mean. Also, there are no utensils on the table. You have no plate. Forks, knives, spoons are missing. You have no napkins. You have no cups for your drink. You have a table full of unfamiliar foods and beverages and condiments, some of which look like they could satisfy your hunger, some of which appear like maybe foods that you don't want to try. Overall, you're unsure of exactly what you're looking at, and you don't have the resources you need to be able to consume the food, to try the food, to better understand what it is you're looking at. You're overwhelmed with options and you aren't sure how beneficial those options are to you. This is an example of what it can feel like for a patient to be overloaded with information that they do not have the resources to be able to interpret accurately. What exactly are they supposed to be able to do with that food? As the staff, you expect them to eat it and enjoy it. You've put so much hard work into preparing this meal. You have trained for years to be able to cook these delicious foods. You have so many other patients that you have to serve at their tables. You don't have the time to sit down with that patient and explain every single thing on that table for them. So it's not to say that the staff isn't also met with their own information overload or expectations overload as well. The system is to blame from each of these perspectives. Ultimately, there's a false assumption that because the information was provided to the patient, that means that the patient should be able to understand it. And unfortunately, that is just not the case. Now, we know that we can look to the patient's personal, individual health literacy levels. We know that that is a factor in their ability to understand the information. But nearly 9 out of 10 Americans have struggled with limited health literacy in some way. That's the vast majority of the population. That also includes health professionals. Statistically, it has to. So personal health literacy is not always to blame in these situations. There are so many other factors that influence how a patient is able to receive process, understand, and apply health information to themselves. Examples of things that patients are being asked to consider under tremendous burden, pressure, and information overload. They're being asked to consider risks versus benefits, oftentimes not fully understanding what the risks are and what the benefits are. They're being asked to make a decision within a certain time period, or to understand how making a decision more or less quickly can affect their ultimate outcomes. They're being asked to make these decisions under clouds of uncertainty, whether it's personal uncertainty about their condition or their diagnosis, or it's uncertainty about the treatments or therapies that are being recommended. It could be uncertainty about next steps, or it could just be general uncertainty about how their decisions can affect their future. They're being asked to consider trade-offs and opportunity costs. If I choose option A, I'm inherently choosing not to do options B through Z. They also have to consider the trade-offs of doing nothing, because that is also a choice. And it's a choice that many patients are considering. Am I better off just letting this ride, continuing on with the status quo? Or am I better off choosing a treatment or therapy or next step? And what does that mean for my outcomes? This decision-making process is not easy. As healthcare professionals, we also have to make those difficult decisions under clouds of uncertainty. We have the benefits of having an educational background where we have specialized in the area that we're working in, and it's still hard. So imagine how it feels for a patient to have to consider these decisions when they don't have that background and they don't have the context that they need to be able to make them effectively. Providing more information sometimes feels like we're doing the patient a favor, when really, if we understand what that patient experience or that patient journey is in that particular moment and in that particular context, we might realize that more information is not always the answer. We might understand that tailoring that information, and not just the type of information, but the way it's delivered, the way it's communicated, the sequencing, that if we can tailor that and align that to the patient journey, we can more effectively support the patient where they are. Unfortunately, due to siloing across different functions, like I mentioned, patient experience, healthcare marketing, health communication, health literacy, due to our systematic failure to cohesively support the patient through this journey, we haven't been able to effectively do that yet. The silver lining here is that because we haven't done it yet, there's still an opportunity to do so. However, the resources needed to do so are going to be incredibly important. And to this point, resourcing has been minimal. It has been insufficient. It has been happening in pockets through small grant programs or small pilots, but there haven't been broad, sweeping, system-wide initiatives effectively mapping health communication and health information to the patient journey. This is a tremendous opportunity for systems and institutions to dedicate resources to improving organizational health literacy that prioritizes the patient journey and the patient experience for the benefit of patient outcomes. I'll see you in the next episode of Health Literacy in Real Life, and I would love to hear your thoughts on how healthcare marketing, health communications, health literacy, and patient experience can work together more cohesively to positively impact patients.